So I'll just share my screen.
That seems to be appearing fine.
Okay. So can you see the presentation, right?
I'm seeing it fine anyway. If anyone has any problems, let us know in the chat, but
Okay.
It's looking good here.
Okay. So I'll just set up a time here. Okay. So good morning, good afternoon, good evening. I don't know where exactly everyone is right now, but it's a great pleasure for me and definitely for our SEAS team to be talking here at the STORK series to present a little bit of our work. I want to thank very much for this opportunity to the organizers and especially to Dr. Umpierre for this kind invitation. Well, I wish to give you an overview of the strengthening the evidence in exercise science, trying to highlight contributions and perspectives of regarding the work that we've been doing and also the doubts and the questions and problems that we deem important to be tackled in our field. So my goal is not present our results or our process in a very detail, but to mix up things here, talking about our area, our discipline, our findings, and how we can together get better. These are my conflicts of interests. I have professional ties with the Federal University here in my state. I serve as a clinical research director for at Hospital de Clínicas de Porto Alegre, which is my city, and I have delivered some paid course regarding systematic review methods, which may be somehow related to this content. I will do my best for these ties to not have influence in my talk today. Well, we planned to present to you our principles, the why regarding the SEAS working, why we run the SEAS initiative, a little bit about our process, so our team and our workflow, our data and our perceptions, what we've been seeing with this work, and finally, a discussion on perspectives about our work and challenges about our discipline. Okay. So here's the basis of our project. Our overarching aim is to contribute to the improvement of scientific evidence in studies with exercise or physical activity. We do that by attempting to accomplish two or three main aims. And so we established a design of a collaborative, nonprofit, highly transparent initiative to assess publications, especially systematic reviews with meta-analysis and randomized controlled trials in the exercise sciences. We have a narrow audience, which consists of researchers and journal editors, although we also pay attention to the general public, but we still do not have an action in this scope. And we used some project benchmarks, such as the Compare Trials project, which was conducted in Oxford University and was coordinated by Professor Ben Goldrack. Also, the Curate Science website was an important reference to the organization of our website. But I would say that the reforms and the movement that has been occurring in the psychology discipline is and have been important for us, because the Cs use a kind of think global but act local principle, which is not really local, but local in our area of exercise and kinesiology. So, and the psychology, although there is discussion about the movement and about the actions and projects, the psychology has, in the last decade, taught a little bit about that, about the projects in their area. And I think we could use that as a platform to address some problems and some challenges, not only problems in our discipline, in our kinesiology area, right? So I should start by saying that a lot has been done. And so I use this very known quote: "We are standing on the shoulders of giants," and here is the consort statement working group. I know that I could have used dozens of other group pictures, because there are many people doing good work for the improvement of science and of their specific fields, either national or international, in either in national or international projects. So I just use that as an indicator of people that have been working. And we use a lot Consort, Tideer, Prisma, which are documents that were developed by some of these people. And talking about these documents, which I also will use or will name as resource in a more general sense, it's abundant, right? We have the availability of hundreds of reporting guidelines to write scientific material, scientific articles. If we go to the Equator Network website, we see that currently there are 458 reporting guidelines available. So it's very readily accessible for us to consult this resource. We also have resources that are public repositories to share data, to share additional materials from different types of studies. Here I list 4: the Open Science Framework, Figshare, Zenodo, and Harvard Dataverse. But many other resources and repositories may also be useful for us. So the point is how we've been using, promoting, adopting such documents, such practices. And it's not so good. Douglas Allman, a sorely missed giant in the field of health science, at least in my opinion, had this comment in 2015, which highlights that we still have key information that is missing from published trials. We could extend that to several other types of studies, And in the SEAS initiative, we not only pay attention to clinical trials, but also to systematic reviews. And evidence is plenty about the poor or at least suboptimal adherence to reporting guidelines, to good practices materials, to public repositories for data sharing. So what's missing? What do you need to do to improve, to do better, to have more reproducible, more replicable studies, to more to have to promote and to adopt and to use more transparent practice? I will try to make the case that we need to plan, to act, to promote, to expand implementation. If you look and if you actively look for this word in several reporting guidelines, implementation, implement, adoption, you will not find much. And I think that that's one missing part. That's one missing part of the problem that we aim to address, but it's an important part. So uh, I will show you how we try to work on implementation, which is basically on a post-publication phase. Publications are sometimes considered a final milestone, but for me and for the team, we certainly consider that as our starting point. Okay, this is our team, which is awesome. We have nowadays 10 people working weekly on different types of tasks, which I will show you in a bit, a general overview of the workflow. We also have 2 doctoral students joining the team very soon. They are already piloting assessments and reviewing our protocols and our manual of procedures. But especially I would like to thank a lot to this team, because they the SEAS is not a main project for anyone here. It's kind of a side project for master students, doctoral students, postdoc fellows. So obviously we try to have sustainability, try to achieve sustainability for the SEAS initiative, but it's still relying in a very individual wish and collaboration from these people. And we are definitely open for collaboration. So if you get interest, please get in contact so that you can have your photo featured in this slide in the near future. Okay. So talking about our workflow, we do systematic continued surveillance of published evidence. We run monthly search since the beginning of 2019. We run monthly searches in previously selected journals. For the field of exercise science, we started with 9 journals, and we recently reduced that to 7 journals because there were 2 journals with very few studies being retrieved. So for our for our ongoing wave of assessments, we are using 7 field journals, which include British Journal of Sports Medicine, Medicine and Science in Sports and Exercise, Sports Medicine, Scandinavian Journal, and some other common journals that we can find systematic reviews and clinical trials. That is the main criteria that we use to select journals. Nowadays, we have a ceiling, a limit to the number of publications each month for assessments. So we limit that for 10 publications in total, being 5 systematic reviews and 5 clinical trials. We do everything in duplicate, so we have at least 2 people assessing each of these publications, and we consider this approach a lively approach, because the project, at least for now, doesn't have an end. When we assess a number of studies, we do that every month, so that we can, uh, in months or years, hopefully see some progress. So how we do the assessments? We currently assess more than 50 items for systematic reviews and for clinical trials. For systematic reviews, we base our methods in 3 main documents, 3 main resources, which are Prisma, Robis, and Amster2. And for the RCTs, the items are mainly derived from the consort statement and the tidy or checklist to report interventions. So we consider these methods to be implementable, because anyone interested in this area can can refine, can select specific items, and have these documents to consult and to implement this process, and also scalable, because these documents are not restrict. They were not developed for exercise science. So if people are more interested in nutrition, in child health, they can somehow adapt these documents to check the methodological rigor and the reporting standards in those studies of interest. And finally, but also importantly, we act on our dissemination in a somehow counterintuitive way, because one natural way people think about disseminating research evidence is writing papers. We have been doing that too, but we primarily disseminate our findings, our methods, through a more fluid way, using public repositories, using email to authors and editors, using our website. And we have a more we have a quicker way of communicating, of correcting what we need to correct, and also implementing a feedback philosophy here, especially from our wish to communicate with authors, so that we can refine our process, and we can also promote practices that maybe not not well understood, or even some we have the experience that others told us, well, I was not aware of these documents, so we can present to them this way of reporting and planning their publications. So this general workflow. In more specific, we have pre-specified PubMed queries. We have also pre-specified eligibility criteria for systematic reviews with meta-analysis and also clinical trials. it's not appearing the criteria here, but basically for systematic reviews, we are interested in reviews that summarized physical activity or exercise interventions. And for clinical trials, we are also interested in physical activity or exercise interventions. In the beginning, it was more open because we would include studies with athletes, but not only with exercise interventions. So the interventions could be more mixed, but nowadays we are more strict for physical activity and exercise interventions, usually longer than 1 week, let's say. So our assessments are also in duplicate in an independent way, using two assessment forms with different complexities, so that we can have people who are not very trained, because these people will extract more objective information, more demographics information, and we will have supervision. And also we have a second form, either for both for systematic reviews and clinical trials, which both have a higher complexity and items that derived from these resources that I commented earlier on, but have some interpretation which is not so black and white. As a fourth step, we give the feedback to authors using the item by item individual report of the year study, and we reanalyze mistakes whenever authors claim a point that may be a wrong evaluation, or they are not in accordance to our assessment. So dissemination consists, as I said, of a website, primarily data sharing in the open science framework, and annual reports sent to journal editors. Here is the website outputs. We have monthly packs, as we call it, showing the studies that were assessed for a given month of a given year. We are about to start placing, including the 2020 assessments. And when people click on a PMID, a PubMed identification number, or in the title of the study, they go to a second level, which is a study level showing 7 domains, which are critical appraisal, outcome, intervention or exposure, participants, methodological rigor, completeness, and transparency. Why we made that? Because in total we assess several items, and it would be more complex to have each one related. So we grouped together some comparable items. For example, in transparency, we put the registration record, if it yes or no. We put the data availability statement, if authors simply reported, not only would share, but simply reported whether they would share or not. They would be scored, they would be rated as a yes for the statement about data sharing, about data availability. And we generate this individual report, which is hosted in the open science framework, of our project. We have links in this web page, so it's accessible for people to navigate along these documents. Here's our a partial snapshot of our report. So authors receive this 2-page PDF document in their email. The corresponding authors will receive that. And we have some results, of course. So going to the third part of our talk today, let me just, okay. We have three, so far we have three main products of our process, which are our protocol, our rationale and methods. We have a more specific, very, very hard document to be drafted, which is our manual for standardized operational procedures. So each item has its definition for the rating and the decisions. We have been working on the updated document because we included other items, and it should be in public very, very shortly. And so far we have a preprint posted in the Meta Archive preprints. This was mainly prepared by Norton Oliveira, which is our general manager for this project. And so Norton, I think, is watching here, and I should thank him for incredible efforts for the SEAS initiative. And Norton prepared with Cynthia and Angelica and myself this systematic review and meta-analysis report. So a lot of what I'm talking about regarding the items, the domains, can be found in this preprint, which is also submitted to a conventional scientific journal. So a little bit of our demographics on assessed studies. In the year of 2019, which is our completed and concluded assessment year, we had a total of 237 studies assessment, being 103 systematic reviews and 134 clinical trials. So we communicated with all possible authors. I'm not sure if we had the email or we didn't have bounced emails for everyone, but definitely we sent more than 200 emails with the reports. Unfortunately, so far we have only received 18 replies requesting corrections or requesting further discussion about any assessment. In general, these 18 replies were great, were a great opportunity to discuss about our methods, to clarify. They helped a lot to clarify what we wanted, what items and how we wanted to assess. And we look to ways of engaging authors in a more expanded way. Talking about the adherence to specific items, we see some items with nice results, which we would consider for at least a prevalence of adherence equal to or greater than 50%, let's say, which I call here as moderate, to high adherence. So we can see that title identification either for clinical trials or systematic reviews is well adhered to. The statement for methodological designs, or especially for trials, is also a prevalent item. The research question is well structured, usually using the PICOS structure, this acronym for systematic reviews, and registration is also a common practice. So these are good results. We also observe some suboptimal results or results with poor adherence to. And talking about protocols, we have a small proportion of systematic reviews with meta-analysis having their public protocol available. Here, I should say that we consider the systematic review protocol as a document, as an open document, displaying the methods for a systematic reviews, displaying more specific methods. We have had internal discussion whether to, an internal and external discussion whether to consider Prosper registration as a protocol, but so far we have not considered Prosper protocols, Prosper registration as a systematic review protocol. And for the clinical trials, about 1/4 of clinical trials have an available protocol. Data availability, I should say here is a statement for data availability. It's not a decision for data sharing. It's only a statement whether or not data would be shared. And we find a little high, a little up than 1/3 of the systematic reviews with this statement, and around 1/5 of the clinical trials with data availability statements. And so to finally address some perspectives and future challenges, one important question, at least for me, is whether we are working on the right problem. And we are restricting our action and our project in a post-publication phase for published reports, but it's widely used. It's widely scored for promotion, for career progression, for hiring, and for the use of evidence. We are seeing for the COVID pandemics that articles and preprints are highly valued, especially if they are in the so-called high impact journals, which is based on the very wrong metric of impact factor. And I use this document here from the Lancet series on research waste to reflect about the nature of the problem that we are addressing at the CIS initiative, but I think it may have an impact to improve things. A second aspect is what is missing, what is lacking as a part, as a adoption part in the current guidelines that we have. This scoping review published by Blanco and colleagues shows some gaps in research for the evaluation of reviews regarding the attempt to improve adherence to research guidelines. And we see that such interventions mainly exist for the manuscript writing phase, which makes sense because in fact, these documents orient the reporting, the manuscript reporting, so the phase of writing an article. Manuscript submission, especially as an encouraging behavior, encouraging an endorsement action from journals, or at the peer review phase. We do not have large interventions for training of these documents to promote the learning of these documents, and we, using that on a weekly basis, have several difficulties in making it operational, making it functional, to be assessed or even to be used. The examples sometimes are confused, or they are not complete, or they are not applicable to each study, to each study area or field. So we need to think about this blank space here, and at least for me, I consider that reporting guidelines are only an initial step that may allow people to do better. And so one final question is whether we are working on the right way. I'm sure that guideline developers, when they were developing the consort statements, the Prisma statements, they were really excited to be drafting a resource that may and do help lots of us to report better. But these good practices are not so good if they are not adhered to. So this applies to the CIS initiative as well. So whether we are assuming that we are working on the right problem, are we working on the right way? Because we have to be aware that our methods are far from perfect. It's hard to implement assessments in this way. And it's hard to run the initiative on a continuous basis. Assessing others doesn't make us right. It's not a black and white process. So it's really hard. And we have made mistakes. We are constantly improving our methods and our scrutinizing process for our working too. But we also have nice things, in my opinion. We don't hide mistakes. We try to be internally and externally as open as possible. We share as much as possible. You can find our raw search queries. You can find our raw data. You can find the versions of any modified document in the open science framework. So we try to be really transparent, and so we also know that transparency takes lots of resources to be implemented. So we don't consider transparency as a black and white thing too. And we are working on a adoption and implementation end of good practice. We are not at this moment saying what people could do. We are just checking things that already exist and things that have already been made. I would like to acknowledge the work of the CIS team that I already displayed in this presentation, and some other fellows that have been worked with us in the past, and also David Moher and Claire Arden for their senior advisory for us. Again, thank you, Weimer, for the invitation, STORK, and to our participants, let's say, in this way, that are the authors and editors. Thank you.
Thank you, Danielle. So interesting. It's it's such a big project. I had obviously seen the website, but I hadn't understood maybe just how comprehensive it is. Thank you so much. I think it's really nice this week, and then we had a seminar recently by Jenny Murphy. I think I see her here. It's so nice to see these projects that are actually aiming to actively tackle the issues that we're kind of talking about. It feels good. Guys, overall, we've got Danielle here for the next 10 or 15 minutes. Please feel free to post questions either in the chat or just unmute yourself and speak directly. But if it's okay with everyone, I have been jotting down, I'll start out with one of mine. Okay. Daniel, I find it really interesting at the beginning where you were talking about the kind of the range of resources and tools that are available. In your opinion, would it be useful to kind of develop exercise science specific guidelines, or should we focus our efforts on promoting the tools that are already available, the more general, like you mentioned, the Prisma, the Consort? I've struggled to decide if specific would be just one more thing that we all need to learn about, or whether they would be useful. Any thoughts, or anyone, any thoughts?
Okay, yeah, I think it's a difficult question because it's complex, right?
Yeah, of course.
Depending on our objective, I would pick any, but as I said, I consider that we have plenty of resource that could be somehow implemented in different biomedical science disciplines. So as a very, very straight reply, I would prefer to concentrate efforts on adapting existing resources and focusing on the use and promotion of these resources, especially because since our time and our work resource are very limited, we know that it takes time to develop something. So I would prefer the way of trying first, learning if something more specific would be needed, and then if it is the case, and then making something new, because I think it would be in a more refined approach if trying first.
Makes sense. We have a question here from Eduardo. Danielle, congratulations for the presentation and project. I'd like to know about the feedback of researchers regarding the assessment of their papers in general. Positive, angry? Is there any understanding of the relevance of the project? Great question.
Yes. Thank you to my friend, Eduardo Cadori, for this question. Usually it was very positive. Sometimes and we had a very recent, so nice discussion about our criteria to assess an item in systematic reviews. But whenever things got more serious, was about our methodology. And I consider that very, very positive. We had so much luck that actually the very first report that we sent was about an excellent systematic review, and the researcher was associated and very active with the Cochrane collaboration, and she helped us through her claims. She helped us to clarify, I think, perhaps 4 to 5 items that, well, this makes a lot of sense what she's talking to us. And well, it was a great first reply. One thing that was very rare, I think, only happened 1 or twice, was what what we call in what we would call in Portuguese the, how can I say, the wallet showing, the carteiraço, the wallet showing, the ID showing. You know who I am. I don't give an ass for for your assessment, because, but it was very rare. I think it just happened once, and well, perhaps some other people who silenced thought this too, but I think that this act from Brazilian fellows, not a very advanced country in in some sense of science, is positive. I think that perhaps if we could test if placing a Harvard handle in my email would bring more replies, I would do, because I think people silence because, well, after all, these are just some Brazilian guys doing this kind of thing. But I think it's nice to play with that too, but mostly positive.
Nice. I think it's really interesting for me that it's only quite recently that I have, suppose, gotten more involved in open science overall. And at the beginning, I didn't realize that really what it was or what things, and then the more you're in, the more you see and the more you realize. And I wonder, in the next few years in our discipline, will all of these things become more and more the norm, as we kind of see in, say, psychology? I think we're at a similar phase to maybe where psychology was a few years ago in terms of really pushing these within our own discipline. And I wonder, will people become more and more receptive as it becomes more and more the norm to talk about?
Yeah, and I think the STORK as a society helps a lot on that, because we can catalyze things and projects, implement and grow our networking, and I think it's greatly needed. And I think a society, especially toward this objective, can help a lot on that. And as I said in the beginning, perhaps using psychology as a benchmark, or this concept of think global but act locally, and locally in kinesiology, can help to prioritize and to discuss, and so that we can define what may be more useful for our area at this moment. So yes, Emir, I tend to have a very similar opinion, because I think it's easier at this moment to correct things inside first.
Yeah,
Yes.
absolutely. I really liked your end slides where you're kind of like, are we asking the right questions? Are we addressing the right problem? And I think certainly, as an initiative, it sounds it's a fantastic initiative, and I think certainly is getting to an important issue. But I'm curious, what do you think moving forward? What would be your kind of, what's the gold standard? What's the ultimate goal? Where would you like to see this going? And what do you think is the core problems that, if we had all the time
Yes.
and money in the world, that we could get
Yes.
to?
Yes. It's challenging for me to think about it, because sometimes I have this dilemma of thinking on the project, and I would think for the project in more a linear way of perhaps having more advocacy with editors. I think we have sometimes, and we have done that, make editors discomfort, right? Because they cannot allow errors to be permanent in their journals, And nicely, we had some positive outcomes from these actions, but perhaps we, for example, for spin bias, for studies with spin biases, which is basically for those who haven't heard about it, is a behavior, a way of distorting the reporting of results. So if you have a spin bias, you exaggerate a positive results, or you omit a negative result, or a non-hypothesis confirming result. So it happens very naturally with us, with any of us who are more interested in something than about other aspect. But we haven't implemented any systematic action for results with spin bias. We have acted in a isolated way, but that would be one of the possible things, and advocacy or learning projects. But at the same time, and on the other end, the trade-off of this more linear way are the wishes and the hopes and the ideas of people working in the project. So I have been asked if we are monitoring the female participation in studies in exercise sciences, so that we could have an idea of gender gap in our area. This didn't come from me. So this is something that comes from our team, or interest in abstracts. So we have studies on that. But I would say that I think that the project, the good thing would be become a public good, so that anyone could use our form, anyone could pick a study from my group, a clinical trial from my group in which I am, or in which I am one of the authors, and could assess the studies from us too. Uh, I think if we make that a platform, things would happen in a very nice way.
I think that isn't that really kind of the dream, that moving forward, you have such a
Yes.
rich database there that
Yes.
potentially people might have their own particular perspective rather than repeating everything. If we could all come together with large databases like this, I think it could be so effective.
Yes.
You made an interesting comment there, female participation. Just to get the plug, let you guys know, one of our next talks in June is going to be on the topic of sex bias in exercise science research. We've
So
got
important.
Dr. Mandy Hagstrom is coming from Australia, or she's based in Australia. I believe she's from New Zealand. So that is a topic that we're going to be discussing, and it could
Nice.
be very interesting to follow up on that. Guys, I see we're coming up to the hour. Does anybody have any other comments or that they'd like to make, or questions that they'd like to ask Daniel while we're here? I think we're probably coming up to the end of our hour now anyway. Daniel, I'd just like to say thank you so much. It's so interesting to learn more. I hope that this is the first of many conversations that we can potentially have moving forward about this. Guys, just moving forward as well, some dates for the diary over the next few weeks. Our next scheduled session is on the 19th of May, and it's Journal Club. We're going to talk about Tal Yarkoni's generalizability crisis paper, and James Steele is going to lead a discussion on whether the concepts there, how relevant they are or how applicable they are in our field. So I think that'll be a really nice conversation. And then in June, our seminar series is continuing on. As I mentioned, Mandy Hagstrom is going to discuss sex bias. And we've also got Graham Close, who's going to talk about research translation, focusing on his paper to podium. work, or their group's work. So please remember, follow us on Twitter, sign up as a member if you can, and we'll keep you updated with those upcoming talks and events. So I think that's it. Daniel, thank you so much. It's been a pleasure.
Thank you so much, Umpierre. It's a great pleasure.
Cheers, guys.
Bye-bye, guys.
And